Case number 12. A 35-year-old male came with painless cervical lymphadenopathy. Lymph node demonstrates preserved architecture, reactive follicular hyperplasia with germinal centers, expansion of interfollicular areas by diffuse abundant eosinophils forming eosinophilic microabscesses, areas of vascular proliferation of small capillaries in the interfollicular areas. These two images demonstrate reactive follicular hyperplasia in the center, extensive eosinophilia surrounding the reactive follicles, eosinophils infiltrating germinal centers, areas of vascular proliferation of small capillaries in the intrafollicular and interfollicular areas. This micrograph demonstrates reactive follicular hyperplasia in the center, abundant eosinophils surrounding the follicles, disruption of follicles by increased eosinophils causing folliculolysis, prominent vascular proliferation of small capillaries. This micrograph demonstrates reactive follicular hyperplasia in the center, extensive eosinophilia forming eosinophilic microabscesses, eosinophils infiltrating germinal centers, and areas of vascular proliferation of small capillaries in the intrafollicular and interfollicular areas. These two images demonstrate extensive eosinophilia forming eosinophilic microabscesses, vascular proliferation of small capillaries, some plasma cells, mast cells, and polykaryocytes. This image demonstrates reactive follicular hyperplasia, abundant eosinophils forming eosinophilic microabscesses, some mast cells, some plasma cells. Okay, what is the diagnosis? It is Kimura disease. Synonyms: Kimura lymphadenopathy, eosinophilic lymphogranuloma. Okay, let's talk about Kimura disease. General background. Kimura disease lymphadenopathy is a chronic inflammatory disorder of unknown etiology. It is characterized by lymphoid hyperplasia, dense eosinophilia, it is an important diagnostic feature, and fibrosis. Most patients are young adult males. Asians are more commonly affected than whites or blacks. It most often involves subcutaneous tissues and lymph nodes of the head and neck. Kimura disease may involve other sites such as salivary glands, parotid, oral cavity, axilla, groin, and extremities. Most patients with Kimura disease have peripheral blood eosinophilia, 10 to 50% in differential count, and elevated serum levels of immunoglobulin E. Kimura disease may cause proteinuria and nephrotic syndrome in some patients. Most patients have a favorable outcome. They generally respond to therapies that include surgical excision, steroids, and radiation therapy. Thank you.